Have you recently been diagnosed with high blood pressure? Is your doctor recommending that you take amlodipine, but you're concerned about the possible side effects? If so, then this video is for you. Keep watching to learn a little bit more about what side effects to watch out for and why this can be an important medication for you. Welcome to Family Med. I'm Dr. Richardson, and this is your home for practical and accurate information to help your family make healthy decisions. This is the channel that focuses on bringing better health to your home. On today's episode, we're going to be talking about one of the most common medications that we use to treat high blood pressure called amlodipine. This is a medication that's been available in the United States since 1990. When it first came out, it was marketed under the name Norvasc. Now, this medication's been generic for some time, so it's usually just referred to by its generic name, amlodipine. Although there are some off-label uses for this medication, its most common use is to treat high blood pressure. Amlodipine belongs to the class of medications called calcium channel blockers. They work by using calcium to block certain processes that cause the contraction of smooth muscles found in your blood vessels. This allows them to relax, decreasing the blood pressure inside of your arteries. So at this point, you may have asked why you should even care that your blood pressure is high. Actually, this is a very common question that I get all the time. I have to try and convince somebody that they need to take a pill that could cause side effects when they feel just fine. They have no symptoms and feel as good as they ever had. Then I have to convince them that they need to take a pill for the rest of their life to treat it. Has that thought ever occurred to you? If so, let us know in the comments below so you can see that you're not alone. But the reason we care about your high blood pressure is because of the impact it can have on your overall health. High blood pressure is a leading cause of heart disease to include heart attacks and strokes, as well as it can play a significant role in chronic kidney disease. Oftentimes we refer to high blood pressure as a silent killer. It's called this because it typically doesn't have any symptoms. When you take your blood pressure, you get two numbers. The top number is called the systolic blood pressure. This is the pressure your heart exerts on the vessels when it contracts. The bottom number is called the diastolic blood pressure. Now, that's the resting pressure in your blood vessels when your heart isn't beating. Both numbers are important, but for most people, we diagnose high blood pressure when your numbers are 140 on the top and 90 on the bottom on a consistent basis. So you've talked to your doctor, and they feel that it's important to add a medication to treat your high blood pressure, and amlodipine is the one that they feel is best for you to try. So what should you expect? Well, first of all, it comes in a tablet of 2.5, 5, and 10 milligrams. The pill is meant to be taken once a day with a top effective dose of 10 milligrams. An important thing to remember about this medication specifically, and most blood pressure medications in general, is that it only works while you're taking it. I have people come in all the time with their blood pressure high after you originally had it controlled, telling me that they stopped the medication because we fixed it. Unfortunately, this isn't the way it works. Unless you have some underlying issues that are causing your high blood pressure, like your lifestyle things, and you fix those, you need to stay on these medications. Don't stop them unless you discuss it with your doctor. Amlodipine is one of my favorite blood pressure medications because it usually is very well tolerated. It's rare the patient that I have that stops it because of any significant side effects. That being said, any medication has a potential for a side effect, and amlodipine is no different. Now, the most common side effects that we tend to see with amlodipine are some leg swelling, fatigue, palpitations, dizziness, nausea, skin flushing, and sometimes some dry skin. Of all of these, the one that I see the most common is the leg and ankle swelling. The reason this happens is that the medicine relaxes the blood vessels. Small vessels in legs will dilate and allow fluid to leak through and cause some swelling. It's usually mild and oftentimes will go away after a couple weeks, but in some it may persist and be bothersome. So if it is, talk to your doctor about your options. Now, the other thing we may see is the dizziness. This is usually a sign that the medication is working too well. If this happens, typically you notice that when you stand up, you get that head rush feeling and may feel like you're going to pass out. Now, if this happens, concentrate on standing up slower, check your blood pressures, and bring those to your doctor so you can talk to them about it. Sometimes all you need to do is just adjust the dose. There are some more serious, albeit rare reactions that you should be aware of and watch for. We already mentioned low blood pressure, but some people can have more of a significant drop that is more difficult to bring up. It can also cause inflammation of the liver, an allergic reaction, and a rare raised rash that often can form on the legs. If these symptoms happen, then you need to be in touch with your doctor right away. Overall, this is a great medication to treat blood pressure. I use it a lot because, as I said before, the side effects tend to be minimal. It has great studies showing that not only does it lower your blood pressure, but it also helps significantly decrease your risk for heart disease and stroke. And finally, it's pretty cheap. Luckily, it's generic and you can get it for a good price. In fact, a 30-day supply at the local Walmart will cost you $4. If diet and lifestyle changes have not been enough to control your blood pressure, and your doctor recommends that you take amlodipine as part of your treatment regimen, hopefully you have a little more confidence using this as part of your treatment plan. Now, this certainly isn't an all-inclusive and in-depth discussion of everything that can be told about this medication. It's not what I'm trying to do here. My purpose in sharing this information is to help give you information that you can think about and discuss with your own doctor. So please don't take this as direct medical advice. Take everything you learned today and discuss with your doctor and how it applies in your own situation. If you found this information to be helpful, do me a favor. Go ahead and hit that like button and share it with your friends and family. And if your health is really important to you, consider subscribing and hit that notification button so you don't miss out on any of our other content. Now don't go anywhere, because if you're looking for ways that you can make a start in your diet and lifestyle changes to treat that blood pressure, click here to watch some simple steps that you can start your diet journey. And if you're looking for other ways you can save money in healthcare, click here. So until next time, this is Family Med with Dr. Richardson. And remember, take care of your body, because it's the only one you have.